hometown, Louisiana. And one question they said, well, Melissa, it's pretty interesting, all the different things that you're talking about with healthcare and all those benefits. That's great. But right about now, my husband and I, we don't have any insurance and we really need to go to the doctor. What can we do in Louisiana? Where do we find those same services in Louisiana that you have in Memphis? Well, guess what, y'all? I dug a little deeper and deeper and deeper, made a few phone calls, called my good friends at Tennessee Justice Center. Thank you for your help as always. And guess what? Here is the information for Louisiana, right? So you all also have what's called Health Insurance Navigators, and they're with DePaul Community Health Centers. And they can be reached at 504-482-2080, extension 2246. Okay, so let's hear that again. You can call DePaul, and you can talk to them at DePaul, 504-482-2080, extension 2246. Now, here's the other thing. There's a second location or second area that you can reach, and it's called your navigators. They're with the Southwest Louisiana Area Health Education Center. The Southwest Louisiana Area Health Education Center. Their telephone number is 800-435-2432. Okay? Or you can email them at navigators@swlahec.com. Let me give my friends in Louisiana that information again. Your health insurance navigators at DePaul, 504-482-2080, extension 2246, or you may call the Southwest Louisiana Area Education Center at 1-800-435-2432, or you can email those same navigators at navigators@swlahec.com. Not only will it help that young lady that called me regarding the information, so I hope that help you, sister, and your families, but also I hope that it will help somebody else in Louisiana. So just like that person in Louisiana reached out to me, feel free to send me an email, send me a message, anything if you need some information or you have questions on how to access benefits in your area, right? All right, cool. Now, there's a second thing that I owe you from last week, right? The second thing that I owe you from last week are the list of the 10 care plans. Yes, there are 4 of them, ladies and gentlemen. There are 4 10 care plans, right? First one is AmeriGroup, 800-454-3730. The first one is AmeriGroup, 800-454-3730. Okay? The second one, Blue Care. Of course, y'all know who that's owned by. Their number is 800-468-9736. Okay? That second one, The second one is Blue Care, 800-468-9736. The next one, United Healthcare, 800-690-1606. United Healthcare, the third plan, 800-690-1606. Okay? Then the last one we have on the list is TennCare Select. Imagine who they own by TennCare Select. 800-276-1978. That's TennCare Select, 800-276-1978. For those people who just joined us, I'm going to go ahead on and give you those again, but this time I'm going to go pretty fast with them, so I want y'all to keep up with me, okay? So now these are all of the TennCare plans that we have, that we call, that I was able to find out: East Tennessee, West Tennessee, and that other part of Tennessee, South, West, East, North Tennessee, right? This is what we have. AmeriGroup, 800-454-3730. AmeriGroup, 800-454-3730. Blue Care, 800-468-9736. United Healthcare, 800-690-1606. And last but certainly not least, TennCare Select, 800-276-1978. Okay, now those are your 4 TennCare plans, ladies and gentlemen. Now, if you're going to ask me, well, Melissa, which plan would you prefer over the other ones? Okay, so I'm going to be honest with you. I'm just going to be honest with you. United Healthcare will be my last. Okay, I'm just doing it a different way. My top 2 are going to be Blue Care and TennCare Select. Those will be my top 2. And the reason why I will select Blue Care or TennCare Select, I'm going to tell you from a claims processing and a payment perspective. From that perspective, they pay providers in a timely manner. I mean, you know, Medicaid reimbursement is Medicaid reimbursement. You know, it is what it is, and, you know, it is what it is. However, you know, those two, they have a tendency to pay faster. They're electronic. There's a lot of, just a lot of pros. I can find more pros with Blue Care and TennCare Select than I can with AmeriGroup and United Healthcare. So like I said, I don't have a preference with either one. Whichever one you prefer, whichever one you know, want to choose, is your choice. But like I said, you know, top 2 would be Blue Care, TennCare, and then after that, it would be AmeriGroup or United Healthcare. Now, the next question becomes is, well, Melissa, how do I actually know if I qualify for TennCare, right? Yep, we're going to talk about that right now. Very first thing, TennCare is just like any other benefits, ladies and gentlemen. You have to qualify. Yes, income will impact your qualifications, right? There's nothing we can do about it. It is what it is. Income has an impact on everything. So one of the primary criteria based will be your income eligibility, okay? Now, here on top of your income eligibility, let's just say, okay, well, you know what? You met the income eligibility. Yay, we met it, right? Now, you can also qualify, you know, here are some other qualifying conditions that may make you qualify or eligible for. I am not saying if you fall into these categories, you will automatically get TennCare. What I'm saying is if you're in these categories, you probably will qualify, and you need to go apply to see if you are actually eligible and can be covered, right? First thing, if you're under 21. Okay, under 21, I mean both my grandboys could have TennCare, right? Next thing, pregnant. Everybody knows that if you're pregnant, you qualify for TennCare. But this is the tricky one. A lot of people didn't know about this one. And what I want y'all to do is, and I want y'all to go to TennCare website and look this up, because I don't make this stuff up because I can't. I don't know how, right? I want y'all to go look it up, right? Parent/caretaker of a minor, right? Got me too. Now, the piece with that is you have to live with the closest relative. So, my grandson could live with me and I would be his caretaker, then I could get TennCare because I'm the caretaker of that minor, right? Next thing is, a lot of people don't know this. I will say ladies, but it's ladies and gentlemen for the first half, because what I'm getting ready to trick a lot of people up is a lot of people don't realize men, yes, can get breast cancer, right? So if you need breast cancer, yes, men can get breast cancer. Yes, men can get breast cancer. So, yes, if you need treatment for breast cancer, men or women, you may be eligible for TennCare in women. If you have cervical cancer, if it seems like it's going down that road or some negativity things are going on, then you may qualify for TennCare as well in that cancer category, right? And then the other way, if you get SSI, then you automatically know you can get TennCare. And everybody know what SSI is, so if you get SSI, you can get it. And the last piece that I want to talk about is for our seniors. A lot of our seniors don't realize that they are eligible based upon what's called a QMB, right? QMB is a qualified Medicare beneficiary, okay? Let's pause there for a second. If you receive Medicare, you may qualify for TennCare if you meet the income eligibility requirements. Yes. Now, that is significant because if you meet the eligibility requirements and you are QMB qualified seniors, that will cover your Medicare 20%. So understand that 20%, ladies and gentlemen, seniors and citizens, those that are paying that portion out of your pocket, that 20%, you know, if you qualify financially for TennCare, they will pick up that 20%. And if they can show you financially needy based upon your application, in some instances, that TennCare will cover your Medicare deductible. Yes. I did say that correctly. So when you think of TennCare just for those young people and those other people, no, QMB. And guess what? If you get QMB, you may also qualify for those homemaker services. Yes. You know how some people have those homemakers that come in once or twice a week? Papa Walter used to get them. He had it through the Council on Aging. We would have somebody that would come in once a week on Saturdays and help take care of Papa Walter while he was alive. And so pretty much they have those same services through TennCare, those homemaker benefits. And I don't think a lot of people realize the additional benefits you have outside of basic hospital, medical, things like that with TennCare. You really have some great perks. And when you don't have anything else to do, just take 5 minutes and invest in yourself. Because remember, I told you now, you're going to have to do something. You're going to have to move now. You're going to have to move. I done brought it all to your lap, dropped it at your feet. Now I'm going to need y'all to do something with it. We good? We good? We good. All right. We moving on. We moving on. We moving on. Now, as we getting prepared for the TennCare Redetermination Fair on tomorrow, I'd like to take this opportunity to talk about our partners, which is something I haven't gotten in great details about because we have 2 great partners, and I didn't get into much details, but I want to go ahead on and talk about them right now because it has really been a truly wonderful experience working with these 2 companies. The first thing we're going to talk about is Amigos Foundation. Wow, Yvette and Dolores at Amigos Foundation, they have been just a joy to work with. Now, Amigos Foundation, their vision is the future is the Latino students and families achieve lifelong self-sufficiency. Their vision is opportunity for all, right? That's a beautiful thing. Opportunity for all. And you know what? The Latino people, just like a lot of us, they have had their challenges and struggles. But, over there at Amigos Foundation, they still want to provide and make sure that there are opportunities for all. And to help with that, we just appreciate them letting us come and use their facility over there on Stage Road 5340, Stage 4350. Stage Road, where we'll be tomorrow. Now, I'm not sure if you're familiar with the Amigos Foundation, but they are a wonderful foundation. They do a lot of things in the community. They have a lot of Latino events during the year. So what you really should do is you should really try and look them up, especially if you're Latino. They have a lot of great information and a lot of events. And they also do a lot of community outreach events as well, right? So we just love Amigos Foundation because, like I said, their vision is the future is that Latino students and family achieve a lifelong sufficiency. Wow. Lifelong. They're not in it for the short term, ladies and gentlemen. And that's why they are one of our partners, because they're in it for the long haul. And they want to make sure that there's opportunity for all. And you know what? That speaks volume. That speaks volume. That speaks volume. Now, thank you, Miss Yvette and Miss Dolores. It has been fun, fun, fun. And guess what? We cannot let this be the last one we have over there at y'all venue, because there's plenty more. So you may want to make sure you call Butron Media, because that's a great place to look at if you're going to have a wedding or a party or a reception or something. Y'all will see. Y'all need to call them over there at Butron Media about that location, because by the grace of God, they're partnering with us, so they're opening it up for tomorrow, right? Now, our next partner, that is the cause of all of this 10-care redetermination fair, Tennessee Justice Center. Wow. Tennessee Justice Center has been around for a while. They're based out of Nashville. They believe in diversity and equity, and inclusion, and necessary to manifest their mission for all. We recognize that racism is the foundational to the social and economic disparities that plague our nation. Wow. In case y'all didn't hear me, Tennessee Justice Center in Nashville believes that and recognize that racism is foundational to the social and economic disparities that plague the nation. I can get down with that. Let's talk about Tennessee Justice Center for a second. Whew, man, from the very beginning, it took me a second to absorb and process everything that they're doing in Nashville. It was just so many different opportunities and so many different programs that they have. I had to list them out. I'm not going to even story to y'all. I'm going to try to get on to them as best as I can. And one thing I want y'all to know, they are committed to expanding and continuous advocacy, education, and litigation work. Yes, litigation, law, litigation work towards greater equity. And you know what? When we begin to talk about the programs that Tennessee Justice Center, TJC, I'm going to just say TJC because I'm going to call them the wrong thing in a minute. Y'all know how I do. TJC, as we get ready to talk about these services, these programs they have, they are amazing. So just listen. Y'all ready? Wait. Y'all got y'all paper and y'all pencil? If you don't get up and go get a paper and a pencil, how y'all going to come to class without a paper and a pencil? Y'all already know. Everybody that know me know y'all need to be having a paper and a pencil, right? Because y'all going to need it when we talk about the second half, because the second half is about the Medicare commercials. So y'all really going to need a paper and a pencil then, so y'all may as well get it now, right? Let's talk about this first thing that Tennessee Justice Center has. Children's health. Wow, 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 wow. They represent individual clients, including children and family, who need assistance with denial appeals, right? So let's pause there for a minute. And to make sure I get this correct, I have been practicing on not reading, taking notes, and all that kind of stuff. But this is too crucial, ladies and gentlemen, to make a mistake. So I brought a note. Okay? And I'm putting my glasses on. Yep, I got the same ones from last week. Put my little glasses on to make sure I read it right. The Children's Health Program provide assistance to appeal a denial of medical services or enrollment for TennCare, Medicaid, CHIP choices, or EFC choices. So ladies and gentlemen, mamas and daddies, parents, grandparents, if your child has been denied coverage for whatever reason, and I hope y'all still have that denial letter. It doesn't matter if it was last week, last month, you know what, last year, before COVID, just go find the letter. Just go look for the letter and find the letter, okay? Because when I finish giving you all the perks about the Tennessee Justice Center, I'm going to give you their website and a telephone number. So if you have been denied, they can provide you legal services to help you if you are truly eligible and you were denied in error. Okay? Now, that's one program. Okay? Let's talk about the next one. The health justice, right? Y'all, these people are just amazing, kind, wonderful. Everybody I talk to whenever I call there, they're just wonderful. And this health justice is a directory of resources with information about eligibility for various public programs, food assistance, and more, right? This is a whole separate program, something totally separate and apart, right? They provide you information on food assistance, right? Remember last week, ladies and gentlemen, we were talking about food insecurities and there's a food desert in North Memphis, right? These people, even though they're in Nashville, ladies and gentlemen, they can still help you and provide you and give you guidance and direction on how you can get assistance with food. So you don't have to suffer in silence. You don't have to be alone. Babies, y'all don't have to be hungry. You don't have to be hungry. Your children do not have to be hungry. You just have to do something. And Tennessee Justice Center is here to help that, right? Okay? The next one they have, this is one of my favorite. The Independence Team. The Independence Team, they're focusing on the senior population of the group. This team works to support the dignity and independence of seniors and individuals with disabilities, right? So notice, they are taking the needs of the community and they're categorizing them, right? They're breaking them down into categorizing. Now, you understand why we're partnering with them? Y'all, it's all making sense now. It's clicking right. And this is why we're doing this, right? Because until community health partners, remember your 5 whys, if you go back to that first episode, the 5 whys about community health partners, until we actually get that physical location, we're going to do community outreach and work with our partners. So based upon these different programs that Tennessee Justice Center, TJC, offer, you all can see we will continue to have programs like this because I definitely know you all want to know about this senior program. And during the next one, we're going to get into more depth information about that interdependence team, that senior program, because it's really focused on seniors and those individuals with disability, which is really great. This is one of my favorite. It's one of my favorite programs they have. Anti-hunger. Anti-hunger. TJC is working to battle hunger. Okay? They're working at all angles, right? They're saying, we want to help you. Let us help you. We are here for you. The mission, TJC mission, is to end hunger in Tennessee by protecting and strengthening SNAP, WIC, and a child nutrition program. They want to educate families and individuals on how to access these programs, how these programs work. And most importantly, what they want to do is, if you're denied for one of these programs, they want to provide you legal services to help you understand the why behind the why you were denied, were you truly denied, or you should have received those benefits. Let's get them, and then we're going to back those benefits up. I told y'all, these people are deep, right? This next one, the health equity, it just keeps getting better. There's more, as they say, right? The health equity, their mission is to ensure that our laws, policies, and program reflect and honor the value and potential of every human, regardless of the income, race, gender, sex. Everything is rooted in the goals of health equity across the board. No one is left out and no one is left behind. There's only one thing you have to do, ladies and gentlemen. Just move. Just call somebody. Just pick up the phone. Well, Melissa, when you going to get a number? I'm going to give you, I want y'all to watch. If I get your number too soon, then you're going to start watching me. Y'all going to call them, and you may not know there may be more services that y'all need. So just, you're going to get a little bit more, okay? This is the last one. That's why I told you, hold on, right? Last, but certainly not least, TennCare Renews. And that goal is to help individuals and families keep their coverage. And that, ladies and gentlemen, is our partnership with them for the event tomorrow. Now, I just want to make sure that everybody understands this. So I'm going to go over this, a little fast, but not really fast. TJC helps with eligibility determination for TennCare health insurance. They help with Cover Kids health insurance. They help with SNAP, which pays for food. WIC, which pays for food. Choices, which is the home care services. Remember I told you about home care services? But the one thing that they help most with is these TennCare Renews. Now, before I jump into the renewals, let me go on and give you all their telephone number and their website. Y'all ready, ladies and gentlemen? Everybody ready? I'm finally finished with them, right? Their website is www.tnjustice.org. It is up there on the screen, ladies and gentlemen. That's the Tennessee Justice or the TJC website, www.tnjustice.org. And their telephone number, ladies and gentlemen, is 615-225-0331. Last time, their telephone number is 615-225-0331. And this has been an amazingly wonderful experience to plan this event with Amigos Foundation and Tennessee Justice System. But there's an old saying, the word gets around, the word gets around, the word gets around. And the word about the health fair got around, right? Oh, before I go, ready to talk about this TennCare? Let's talk about it. I hope the word is getting around. I hope the word is getting around. That's the last time y'all see TennJC number on the screen. 615-255-0331. Now, 255-0331. Now, let's talk about these letters, right? So for the event, when you all come to the event, look, we'll have it broken down by letters, right? So make sure you bring your letters if you come, right? If you got a letter in April, according to them, approximately 54,000 letters was sent out in April, right? As approximately 54,000 letters was sent out in April. That's a lot of letters. Now, I don't know how many y'all returned them, right? But it was due, okay? Now, in May, they sent them out approximately 56,000 letters, right? June 9th, approximately 70,000 letters. And July the 6th, approximately 70,000 letters. So Mr. Cash is going to leave that up on the screen. So we're going to talk about these letters for a minute. Y'all think this is a joke, you know. Now, I don't know what you do on your own time, but while we're here now, we're going to talk about these letters because this is significant. So you had those 40 days, and there it is on the screen. Now, you know what you did with your letter. Please go and look for that letter. If you have not received it, it's okay. If you come, we have a way to help you if you have not received your letter or if you think it's due, right? But we want to make sure you understand that you need to bring your letter if you have it. Now, if you're going to come, this is what we want you to make sure you bring. If you have it, we want you to bring your letter, as I said, of course, number 1. Number 2 is a valid email address. We need everybody to bring their valid email address because if y'all can do the math, if y'all look at the information on the screen, y'all see by tomorrow, approximately 200,000 packets will have been mailed out by the time the event happens tomorrow. That's why we need everybody to make sure these packets are out here. Somebody has to be receiving them. I don't know where they're going. They're not coming to me. So if you moved, your packet went to your old address. Now, I can just tell you that right now. So if you moved during COVID, I can't say everybody did, some did and some didn't. So just know, if you're a 10-care recipient and you moved during COVID, whatever apps you had on file, that is where your letter is going to, okay? Now, bring your packet, bring a valid email address. Yes, because when you enroll, everything will be done via email. You will have to have a valid email address, and it needs to be an email address, ladies and gentlemen, that you can access during the event. Please don't come there and say, oh, I forgot my password to my email. Well, make sure you can get into your email. You've created your email. If you don't have an email right now, you can go on to Google, right? What I tell y'all every week. Google is your friend. Google is your friend, right? Go on Google and create you a free Gmail. Do it tonight. Because if you come tomorrow and you don't have an email, you're going to have to take 2 steps back and get an email account. So that's going to take us 2 steps backwards, right? So if you know you don't have a valid email, work on that tonight because you definitely will need that. Now, some of you I had the opportunity, I should say, to go out previously and do a 10-Care Connect login. If you previously created a 10-Care Connect login and you remember your login, please, oh, please, oh, please, oh, please, bring that login with you. As a matter of fact, if you have a 10-Care Connect login and you have a letter and you have an email, write all that on that letter. But if not, write it on an envelope. Just write it somewhere all on that so we can have it on all one piece of paper. But if not, it is perfectly okay. Because even if you don't have a letter, we will still be able to help you, right? Because we won't know until you get there. So do not let the letter deter you from coming because we will have so many other great things for you there as well. We will have school registration. So if your child needs to be registered for school, you will have the opportunity to register your child for school, as well as if your child will need vaccinations this year to go back to school. So those kids going to pre-K, elementary school, kindergarten, we know they need those vaccinations. So, hey, come on out and get those vaccinations as well. And who knows, you may be able to get some teen care. Now, last thing, if you change jobs doing teen care, right? If you change jobs doing teen care, because some of us did, and if you did, raise your hand. I changed jobs doing teen care. Yes, ma'am, I sure did. So, which meant if I was going to be a participant at the event, well, I am, but I'm going to be a volunteer. I'm not going to be really applying for teen care, right? We already know that. But if it was me, then that means I would have to bring a recent pay stub. So if you have a recent pay stub, that's going to make it a whole lot smoother. So remember, ladies and gentlemen, renewal packet, valid email address. If you don't have one, it's fine, a Teen Care Connect. And if you change jobs while you were on Teen Care, a recent pay stub. Okay? But ladies and gentlemen, this event just keeps getting better, right? I am not going to tell you how the word is getting around. Guess what? We have somebody that's going to be at the event. We are fortunate to have Methodist Labana Community Outreach join us tomorrow. Wow. That is awesome. Yes, Methodist Labana Community Outreach. And just a shout out to Miss Charrow for coming out tomorrow. I just can't wait to see you again tomorrow. It was great, great, great meeting with you to learn all about your program. Y'all ready for her information? Of course I have the 5 W's in it. Y'all know I got the who, what, when, where, how about their program, right? Y'all ready? Paper and pencil? I told y'all was going to need it, right? Okay. Program is called the Nurse Family Partnership. Right. The name of the program is called the Nurse Family Partnership. Now, this Nurse Family Partnership, as I said, is ran through the Methodist Labana Outreach. And y'all know what? Look, she gave me this nice little brochure. Can I be like Vanna White and you zoom in? You got a nice little brochure. Cheese. Got this nice little brochure and has all this information. But because I couldn't get all this information, ladies and gentlemen, this is going to be too much. Guess what? Yes. I got some handy dandy notes. And of course, yes, y'all know I did. Send her email asking her those questions. Let's just see how she replied, because this is amazing. This is amazing. Now, before I get into this Nurse Family Partnership, please understand, everything is not for everybody. So, as I begin to tell you about the program, please don't say, why is she telling us about this? I'm telling you all about this because this is going to help some first-time moms, right? And ladies, some of us have been there. We've been a first-time mom, and we know the challenges that first-time moms experience. So, ladies, if you have a friend, a cousin, or somebody in your family that's a first-time mom, I got some first-time moms out there looking, my sisters, Pavi, Daphne, all y'all out there looking. Y'all remember first-time moms, right? Yeah. Catherine, yeah. Biscuit Bacon, Crystal, y'all remember Matasha? I know Victoria, y'all remember that first one? It was a struggle. Well, guess what? There's some help here in Memphis. And I will see if we can find this program in Louisiana. What is the purpose of the Nurse Family Partnership? It walks alongside first-time moms from pregnancy to motherhood by providing access to free personal nurse during pregnancy to support education until the baby turns 2. Yes, I'm going to say that again. This program will support a first-time mom, ladies and gentlemen, free personal nurse until the baby turns 2 years old. I know, right? I couldn't believe it. Where was this one? I know, right? Nurse family partnership. This is awesome, right? Till the baby is 2. That's a lot. That's a long time. That's some good help. Because with that first baby, you don't know what to do. You don't know when to change the diaper, when not to change the diaper. Is this umbilical cord going to fall off, when it's not going to fall off? I don't know. It's a whole lot of stuff, right? They can help you with all of that. I don't even know if they still use Dr. Spock. They might still use Dr. Spock. I don't know. They may. I don't know. Back in the day when I was having babies, that was long back when. They used to have Dr. Spock. But, you know, this replaced Dr. Spock because there's nothing like human compassion, right? And there's nothing like helping your fellow woman, right? In this instance, men, we got you too. We got you with 10 care men. We got you with 10 care men. We're going to talk about that prostate cancer in a few minutes, men, right? Now, the clients, they have access to a free nurse that can answer questions using evidence-based materials regarding nutrition, labor and delivery, breastfeeding, and more. Okay, we're going to take 2 steps back. We're going to talk about this nutrition. Yes is the answer to the question. Everything you eat does affect your baby. That's why they tell you no drinking during pregnancy. It doesn't matter if you're first time pregnant, second time pregnant, or third time pregnant. It does not matter. You should not be drinking while you're pregnant. I don't even care if it's wine. Don't even tell me about Jesus drank wine, but Jesus wasn't pregnant either, right? So we go, yeah, right. Nutrition. There's certain nutrition that has to occur because you're now, as the old folks used to say, you're eating for 2. So everything has to substantiate because you have to take special kind of vitamins, right? You can have so many other conditions that can go on. And if you eat healthy, that's going to help, right? This is your first time going through labor and delivery. This, ladies and gentlemen, is an experience. Ladies and gentlemen, this is an experience, okay? So for you first-time mom, labor is different for everybody. So you could ask 15 people, 15 ladies about their first-time delivery process, and you're going to get 15 different answers. I can promise you that, okay? Because mine is going to be different from your mom. I have 6 sisters, right? Hey, y'all. I hope y'all watching. Mom go, hey, y'all. I have 6 sisters. And I can tell you now, all of us, that first pregnancy was different. May have been about the same time, but they were different, right? So labor and delivery, do you have to have a C-section? What does that mean? Because a lot of people want to have their baby vaginal delivery, right? And some people, if they can't have that vaginal delivery, that dream birth that they're wanting, that's going to impact them, right? Or maybe you thinking you want to do a water birth. What does that look like for you? Or maybe you want to do a home birth. What does that look like for you? And that's what those nurses are for, there to help talk you through this labor and delivery, right? This is the nurse family partnership. Y'all, they're going to be there with this information tomorrow for your first time mom, right? The clients also have the ability to control the topics of the visit. Right. Mom, it's all about you and your baby. It's all about you and your baby. So let me go ahead and answer the question now, because I know wondering minds, inquiring minds want to know. Melissa, can we or my baby daddy or my husband, my significant other, is that person allowed to participate or interact or whatever? Yes and no. Yes, to a certain point, but remember, this ladder is going to go like this, Mom, because you are a priority. So they're just going to be a little branch hanging off. They may come in for a little, teach that dad how to change a diaper, stuff like that. But everything, and I could be wrong about that, so don't go there expecting no teaching no baby how to change the diaper. That was just an example, right? But just make sure you understand that it's about you, mom. So if you want to bring your partner, your spouse, your husband, significant other, whatever that relationship is, it's not that they can't participate. It's just that participation will be limited, because remember, mom, this is your first time experience, and the focus is on you and your well-being, your development, your baby healthy development. And that's why it's so crucial that you take advantage of this program and get this one-on-one free, right? Right. Guess what? The nurse travels to your home, or you can travel to the nurse, or wherever you feel comfortable. You say, well, Melissa, I don't know those people. I don't want those people in my home, because, everybody don't like people in their house, and that's fine. I respect you and I accept you where you are, and I will always meet you where you are here at Community Health Partners. We will always meet you where you are at Community Health Partners. And if you don't want anybody in your house, I wouldn't force you to bring them in your house. Do it where you feel comfortable. You know what? Do you want to go meet at Starbucks? Do you want to go meet at Carolina Watershed? I don't know. What's another nice restaurant, or somewhere you just want to go? The library, right? It doesn't always have to be somewhere where you have to buy something, right? There's the library, right? Park. It's a nice Sunday afternoon. Go meet at the park, right? My point is, it's about you, right? And they will meet you where you are, right? Now, what programs and service they have is called the home visitation. Where? This home visitation, anywhere in Shelby County, right? Anywhere in Shelby County. Can only participate one time. Yes, only one time. Only because, ladies and gentlemen, family and friends, it's for first-time moms, right? So, the world is what it is. We have a lot of young ladies out here, 17, 18, that's, expecting it's your first time. You may be a little nervous, apprehensive. You don't want to talk to your mama because, your mama, right? I'm not judging nobody mama. I'm not criticizing nobody mama, because I love everybody mama, but your mom is your mom, and everybody know how mama can be sometimes. You just may not feel comfortable talking to mama about labor and delivery. Here's a nurse you can talk to, right? Or here's a nurse you can talk to with mom to help you understand, right? Now, are your programs covered by insurance? Y'all know that's the $1 million question. But if you follow the story, ladies and gentlemen, I hope you did follow the story about this nurse-family partnership. I hope you have followed the story about this, because it's free. I kept saying that. It's free. The program does not require insurance. That's what she said. That's what she said. That's what she said. And I quote, Nurse Family Partnership is a free program that does not require insurance. However, we provide resources and support for our clients to obtain insurance. So what does that mean? She's going to tell y'all to call us, right? And when she tell y'all to call us, y'all know what we're going to tell y'all to do. Call Tennessee Justice Center, SECO, or Family and Children's Services. And all of those people will be there tomorrow. Yes, ladies and gentlemen. We will have people there who will be able to speak in Spanish. Yes, yes, yes. Yay, 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 yay. Because remember, Spanish and English is everything we do. Okay? Now, I'm going to go ahead on and bring this baby to an end, because we only have a few minutes left. Got about 20 minutes left. About 20 minutes left. So, yes, in closing about the fair, we just want to make sure, yes, donations are still being accepted. If we have anybody that's listening out there in TV land, anybody that's close, any entrepreneurs out there that need a tax write-off, because remember, Amigos Foundation and Community Health Partners, all donations are tax deductible. Yes, sir. Yes, sir. So if anybody out there wants to make a donation, I'm going to tell y'all what we need right now. We need 100 pizzas. The delivery is $53.40. 4350 Stage Road. We need 100 pizzas. Individually, prepackaged cookies and chips. And of course, bottled waters. And don't y'all laugh at what I'm getting ready to say? Because guess what? We need toilet paper. So if anybody passing by and y'all got some 24 packs, y'all know them Sam rolls, and y'all won't pass by, and y'all not coming to the fair, but y'all, good entrepreneurs, or the Lord just put on your heart, you want to help them people, you can go and run there by Sam's or, Walmart and get one pack of toilet papers and just throw it out there in front of the building, and we'll pick it up and take it in with us. However y'all won't drop it off. Right? Right? You good? We good? We good. And you know what? We would appreciate anything you all donate, right? If you say, Melissa, we got it, but you got to come get it, email, text me, call me, we will pick up. Yes, we will. Thank you so much. We have all of that. We will pick up. Ooh, that was a lot. Now, y'all ready for some fun stuff? Some fun. Y'all know those TV commercials that come on TV all the time about Medicare? I'm going to do it. Where JJ say, Dynamite! Oh, I hate when he do that. But I'm not going to digress because that's another story for another time. Anyway, yeah. I'm not going to do it. I'm digressing. Well, let's talk about Medicare this afternoon, right? And guess what? There's a multitude. Well, I should not say multitude because multitude means a lot. There are a couple different ways you can get Medicare. Today, we're not going to talk about how you can get Medicare. We're going to talk about the different parts of Medicare and these doggone Medicare commercials. We about to clear this up today, right? Please, don't nobody look. Seniors, y'all got your paper and your pencil. Geraldine Fulton, you got your paper and your pencil. Ruby Dunn, y'all got your paper and your pencil. Okay. Just so we'll know, 4 parts to Medicare. Y'all ready? Ready? First one, Medicare Part A, right? Most people get Medicare Part A for free. I did not say all people. I said most people get Medicare Part A for free, but some will have to pay, right? Some will have to pay. It is what it is, right? Medicare Part A provides for inpatient/hospital coverage. Melissa, can you please define inpatient? I sure can define inpatient. You at a inpatient hospital, Methodist Baptist, that's inpatient hospital. Then you need to go to a rehab facility because you got to learn how to walk and you need physical therapy. They'll cover you a first set of rehab because that's inpatient. Anything that has the word inpatient a part of it, or the word hospital or rehabilitation inpatient, if you have Medicare Part A benefits, it will cover those, right? Now, Melissa, how do I qualify for free Medicare? Now, Part A, because remember we just talking about Medicare Part A, right? Now, in order to get Medicare to be eligible for Medicare Part A and not have to pay for it, ladies and gentlemen, you must be entitled to receive Medicare based upon your own earnings, your spouse earnings, a parent, or a child. Okay? Let me say that again. In order to be eligible for free Medicare Part A, you be based upon your own earnings, the earnings of your spouse, parent, or child. Okay? We're going to pause there. Y'all good? We good. Okay. Because everything, everything not for everybody. Once again, one person may get it free, another person may not. That's life, right? Now, to be eligible for Part A free, first thing is you have to be 65 and on Social Security. If you are not 65, before y'all call up here trying to correct me, I am not talking about disability benefits because that's a whole different set of factors. I'm not talking about ESRD, end-stage renal disease, because that's a whole nother set of factors. I'm just talking about basic Medicare for 65. Don't muddy the water. And that's how people get confused, ladies and gentlemen. We're going to make it plain and we're going to make it simple. We will not muddy this water today because I'm sick of them commercials on TV. Okay? Right? Now, that's it for Medicare Part A. It's inpatient. You may qualify to get it free. Some may have to pay for it, right? You can receive it based upon your own earnings or those of a spouse, a parent, or a child, right? We good? We good. Okay? Now, Part B. This is the fun part. Oh, Part B, Part B. Outpatient diagnostic lab routine services, right? And I'm not getting ready to get into MSP questionnaire because that's a whole nother subject, right? But Medicare Part B, that's a voluntary program that requires a payment for all monthly premiums, right? Now, this information is on Medicare, CMS.gov, y'all, so y'all can go out there and check it out. So y'all can't be calling up here and say, Melissa, you quote me community health. No. Go to Medicare, CMS.gov, right? Now, you may be eligible for Part B at no cost. If and only if, ladies and gentlemen, that's my favorite two words. If and only if. If you are eligible for Part A for free, there's a great likelihood you can get Part B for free as well, right? Everything is based on eligibility criteria. Okay? Y'all ready? Let's have some fun. Part C. I don't even need no notes for this. Part C. Part C is what we like to call in my world Medicare replacement plans. And I'm pro and con, 6 in one hand, half a dozen in another one. I'm not going to get off on, depending on what you got going on, is going to determine which way I'm going, okay? Now, first things first, those plans that come on TV, which makes them so wonderful is, the first thing that they say is, they're going to add money back to your check. Okay, let me tell you how they're going to add money back to your check, ladies and gentlemen. Remember just now I told you Medicare, some people have to pay for it and some people don't. So same thing. If you don't have to pay for regular Medicare, when you get over there, you're not going to have to pay for Medicare over there. So they will not be adding anything back to your check. So that's a no-brainer, right? Now, this is where you may get money added to your check, right? If you get one of those replacement plans, it's Humana, Cigna, United Healthcare, whichever one of those replacement plans you get, remember, pay attention, focus. We here to, Community Health Partners going to help y'all manage this, okay? Remember, I told you, some people have to pay for Medicare Part A. This is where they're going to save you at, right? What they're going to say is, their Medicare Part A, y'all just caught up with me, is less than the government Medicare Part A. And that's how they'll add money back to your check. Okay? And it's not a lot. So regular Medicare may be $55 a month. Theirs may be $45 a month. I don't know. I'm just throwing it out there. So when they say they're going to add money back to your check, that's how they're going to do it. That will apply to some, and some it will not. Okay? I'm going to tell you what also makes them more exciting than traditional Medicare. All these wonderful benefits. Does traditional Medicare, you know what, ladies and gentlemen, I'm not getting ready to say one is better than the other one. And, I'm old school. I'm always go with, traditional Medicare, but that's just me because it works well for what I got going on. But let's talk about comparison. Okay, does traditional Medicare give dental benefits? No. But the Medicare replacement plans, the Humana and the dental, the Humanas and the Cignas of the world, they do. Does traditional Medicare give you dental benefits? No. But those replacement plans, they do. Now y'all see why they're more exciting than the regular Medicare plans, because they give you things that you customarily, or services you customarily would not have with regular Medicare, right? And the answer to the question is yes, ladies and gentlemen. If you're currently enrolled on a Medicare C, like we call a replacement plan, and you decided, well, Melissa, I don't like them. I just want to go back to regular Medicare and just take me back to old Medicare. Yes, you can go back to traditional Medicare. However, there's some factors that has to be considered, right? I'm not getting ready to go down here in the laundry list, but if you're on a Medicare replacement plan and you have end-stage renal disease, depending on what's going on and when your treatment started, there's a lot of factors going on. If you have cancer, there's a lot of factors going on, okay? Understand this. That's pretty much the difference between the commercials you see on TV versus regular Medicare. They provide you with services that traditional Medicare does not, right? I am not saying go to a Humana or Cigna and leave traditional Medicare, because that's how government stay with them. I mean, when I get 65, 65, I'm going to stay with them. I'm going to have a red, white, and blue card or whatever, but I'm going to stay with them because that's what's working. That's what's working. And with those replacement plans, there are a lot of rules. You have to stay within your network, your referrals. So you have to be really, really conscious of if your provider is in network. So before you get off the phone, get off this YouTube with me and the channel with me, and you go hop over there and you decide you want to go get Medicare replacement plan because I can get some teeth. That's not what I said. Because guess what? Yes, they are giving you benefits, but you're not getting the amount of benefits you may think you're going to get, right? You may get I think maybe it was about 1,200. I think my brother got with his Humana, maybe somewhere ballpark in there. You know, that is not enough to cover a set of dentures. Dentures running about what, 2,500, $3,000? So no, just going over there because you think you're gonna be able to get some dentures. No, that's not gonna work, right? Now you will, it may fare out a little bit better with your eyeglass prescriptions, right? But there again, if you have traditional Medicare, you can go to a, ophthalmologist, and if you have a medical condition, work some different things out. You work it out. But there's also the the Lion's Eye Foundation. I'm not in Louisiana, but the Lion's Eye Foundation that could help with those eyes. There's a lot going on. Whew. Ladies and gentlemen, it has been real. It has been fun. And I hope that educated somebody. I hope somebody now can manage their benefits. So now when y'all see those commercials, y'all know what to do. If you need any help with some things, you all know what the Tennessee Justice Center does. Right? Now, before I go, I have something so super exciting to tell you all. Why I won't have a podcast next week. Drum roll, please. Yes, your girl, Melissa Mully Table. Ooh, mama. If you could see me now, I'm not going to cry, mama. But I will be the first on the couch with Coach Carla live on TV next Thursday, ladies and gentlemen. Yes, Community Health Partners will be live on TV. Your girl Mully on the couch with Coach Carla. Check out our Facebook page. We're going to update it. Come for more great topics and interesting conversation. because it's going to get real good on the couch with Coach Carla. Carla, I can't wait to see you next week. I'm looking forward to it. All righty, everybody. Thanks. See y'all in 2 weeks. Bye, America. See y'all next time. Thanks for joining. I'm not going to